feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
I had a kebab knife through that hand
Yeah.
and took my knuckle off.
Kebab knife, did you say?
Kebab knife's worse than a dog bite and a human bite.
Jeez.
I don't want to be, abnormal person. This is better if I go with my sickness and die one time.
So you've submitted a urine sample,
Yeah, urine sample, yeah.
but it was meant to be a poo sample.
Poo sample, what is...
So you need to
Oh,
poo.
oh.
That's where all the problems started.
And you talked about feeling suicidal. What is it you thought about doing?
Just, like, chucking myself under a train.
Would you like to see a doctor?
Yeah, I phoned up and booked an appointment.
OK, what's your name?
Spiritual Park.
Surgery Stacey speaking. Sorry for the delay. How can I help?
Why do I have to do... Oh.
Because it goes out every 3 months.
Why doesn't it warn me that
It probably does, actually.
No, it doesn't.
Well, just put it in again.
OK, well, you have got a locum, but you're on the system. Yeah, you're on the system, and there's 1, 2, 3, 4, 5 patients waiting. Oh, bloody hell. All right, then. OK, bye. OK.
Next available.
Move these over to Ferdy.
Spencer?
Sorry.
That's all right.
I'm so glad to see you.
Why is that?
Bloody marvellous last night.
What was I? What happened to you?
Beat me up Monday or Sunday, broke my ribs, and one member of my family, I won't say his name, hit me because he thought he could do me with bad ribs, so he knew I was vulnerable. And the hospital gave me codeine last night, and because I'm on Subutex, I can't take codeine. I'm sorry, I can't breathe properly.
Yes.
I don't like to lie.
That's all right. I appreciate you not lying. You've been to A&E a lot recently, haven't you?
Yeah, I have.
Good morning, St John's Medical Centre. Sarah speaking. How can I help?
I think everyone's waiting like 45 minutes out there. I'm going to get lynched.
Good girl. Let me just move that chair, and then you can reverse into this spot.
Right, push up with that hand. OK? Yeah. See if you can do that every time you get in and out of bed. Are you all right?
Blow. Keep going, keep going, keep going. Push, 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 push. Go on, you can do it, you can do it, you can do it. You're gonna kill me, you. Oh, dear. That cleared your chest, didn't it? Right. When you do stand up and things, do you get short of breath with that?
Well, do you know what? If I was to tell you something like you wouldn't believe is, I'm no better off now for giving it up than I was when I was smoking. I've got more problems now. I've got high blood pressure.
Oh, have you?
Yeah, which I never had before.
Well, it's
My cholesterol always goes through the roof. Every time I give it up, I end up with more ailments than they do if I'm smoking.
But just think how better you'll feel in, like,
Well,
another
the money's
year's
a lot
time.
better.
Yeah, exactly. You got some more dosh in your pocket.
Yeah. I get out and about, because in the winter I don't go out as much as I do in the summer.
No. Mind you, if you had a better wheelchair, you might get out a bit more, mightn't you?
Yeah, well, sometimes if I had a better carer. He's nearly tipped me out the wheelchair on the way here. Him. And standing there laughing, pushing the trolley.
Now you're a young man.
Mine's very high, dude.
Get out of it, you're a bloke.
You know,
Oh dear.
Shed nits. Yeah, you can go to the pharmacy and buy some stuff there to get rid of them. We wouldn't really need to see a doctor for that.
I've been getting breast pains since the car accident now.
Yes.
It's become more predominant with pain, more sensitivity, and it's more my right breast more than my left.
Right. I think we probably ought to examine your breasts today.
Yes, please.
Don't you think? You'd have been here quickly if you'd had any lumps, wouldn't you?
I would have been, or I would have gone to A&E if you wasn't here, so I would have definitely acted upon it straight away.
You would have gone to A&E?
If you wasn't here, yeah.
Don't go to A&E.
All right, fair enough.
How long have those doctors been qualified in A&E?
I don't know, not long probably.
Exactly. How long have I been qualified? Ages.
25 years as I've known you, and
Yeah.
I don't know what other on top of that you've had.
What I'm saying to you is, if you did feel a lump, phone the surgery and you book an appointment. You say, I want an appointment as soon as possible, and then they'll fit you in.
Okay.
As long as you're seen within 48 hours if you've got a lump, that's fine.
Okay.
I just need to look in your eye.
Please don't at me.
Look straight ahead at me. Good. Lucky boy. The eye's going to be all right.
Ah, look. That's not my knockout punch. It's my left hand.
Yeah, well, you're holding that a bit
Yeah,
carefully. Is that giving you a lot of pain?
My knuckle's back. I had a kebab knife through that hand.
Yeah.
Took my knuckle off.
Kebab knife, did you say?
Yeah, went through there.
yeah, I
through
can see it.
An enemy, believe it or not, jumped over in the kebab shop, pulled a kebab knife out. I jumped over the kebab counter and tried to grab it off him. I didn't know that was double-bladed.
Yeah, they're sharp.
Kebab knife's worse than a dog bite and a human bite. I've got so many scars rolled out.
Yeah.
There. More.
Yeah.
More. But I'm a nice guy.
Right,
I'm sorry.
you can take things like ibuprofen, can't you?
I've got ibuprofen, they're bloody shit.
Yeah, this is stronger than ibuprofen, but it works in the same way. It should help to manage your pain a lot better.
Okay, when I saw your face, I was bloody happy.
Good. Well, I'm glad, Spencer. All right then, Spencer. Take care. All the best.
Oh, well, thank you very much.
No problem. Bye-bye.
You're looking at the nipples. Which way are they pointing? Make sure they both go in the same direction.
Okay.
You're not got one pointing upwards and one going downwards. Then you haven't got any nipples that are going inwards.
No.
And you haven't got any what we call dimpling on the skin, so that's a sort of bubble or dimple. Brilliant. OK, you've done very well. Now let's have you lying down. So once you've done that, then you proceed to the feel bit.
If I'm examining a lady's breasts, I'm hoping I'm not going to find anything. But clearly, I've always got to be on the lookout for something sinister.
But basically, your right hand will feel your left side and your left hand will feel the other one.
If you've got to break bad news to somebody, the secret is to always give them a little bit of hope and to break it in little pieces.
And you're feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
Patients who are waiting to see Dr. Corrali, would you like to come forward, please?
OK, so you have an appointment booked for today at 2:45 and you want to cancel it? OK, I'll cancel that. Thank you very much for letting us know. Thanks, bye. 2:45 cancellation, Dr. Savage. You all right, Ferdy?
In everybody's breast, we always find that there's a little bit of breast that creeps up underneath the armpit. It's called the tail of the breast.
Just a little bit of sensitivity under there.
Yeah. You're doing so well. It's very, 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 very good. Very good. The last little bits around the top here. Okay. Well, look, good news, there's no lumps.
Good.
Have a tissue. That was
did
difficult,
really much.
wasn't it? Oh,
That's all right.
look,
It's okay.
you're being a really brave soldier because Having had that accident, it's made you, shaking you up, it's made you feel really vulnerable, hasn't it?
It has indeed.
I think that knowing your patients is really very important as a GP, because with the time constraints, you've got to decide very quickly on in your consultation whether what that person is coming in complaining about is something very serious or it is something not so serious. Sometimes you don't get it right, but you've got to make decisions.
Okay, so what do you think?
There's all sorts of explanations for this.
Okay.
Could be a hormonal blip,
Mm-hmm.
which has been made worse by the shock of the accident.
Mm-hmm.
If you know your patients and they come in and they look desperately thin, or they look pale, or they look worried, you know that they didn't look like that the last time they came, and so there must be something wrong.
It could be part of the general shake-up. That could be what's making it worse, okay? But at the moment, I don't see any reason to refer you to the breast clinic.
Okay.
Now, I've looked at you now, give you some anti-inflammatories, and we'll make a point of revisiting this in a month's time.
Okay, that's fine.
You're happy with that?
Absolutely happy.
Good.
Good. Thank you.
Okay. Hi, Jane.
Hey, baby, how are you?
I'm fine. Can't take a seat for me. What are you doing?
You changed your room. You're moving around, woman.
When did we have one done? Yeah. Okay, not to worry. So you get yourself ready for me, okay? And how you been, James? How's your weekend?
All quiet, watched all my sport, the cricket, the football. Yeah, I love me cricket. I want spring to come because I got that discount rail card I paid 30 quid for. And I get a day down the coast. Half price, see? Get a good weather, I can go to Brockley, change at East Croydon, go down to Worthing. I like Worthing.
You like Worthing?
Yeah, nice.
Well, I like Margate, but...
Margate?
Yeah, our friends live in Margate.
Yeah, that used to be the bee's knees, you know.
I know.
Margate, Ramsgate.
Right, relax this down.
Yeah. Oh, you are gentle, darling.
Right, there you go. All done.
Now, don't forget me blood pressure, darling.
You want your blood pressure done as well?
Yes, because I think you've put it up.
Hello, how can I help?
Can I just collect up a prescription for me, Stephen Harmon?
Hartman, yeah?
Yeah, how are you?
Yeah, I'm fine. Rest of the family okay?
Yeah, not too bad, thank you.
Good. When did you put your request in?
Come in. Amanda, how are you?
Never say never.
What is it that I can do to help you today?
Right, well, I didn't realise I was low on my tablets as I thought I was.
Right, OK. So this is mainly a visit to grab some tablets. I'm very confused by your medication list. So I was just thinking maybe we should just quickly fire through it and try and figure out what you are taking and what you're not taking.
I take all of it.
No, I know, but I think there's certain things on here which just... I just want to check. Make sure we're giving you the right things, right?
The amitriptyline apparently should be helping what I've got up going on the top of my neck, and I'm under the physio at Lewisham as well.
Good. How long have you been on the amlodipine for?
Quite a while now, because they've actually put me on another little one.
Is that the bisoprolol?
Yeah. And have they put the morphine on repeat as well?
Well...
Because I've been on it long enough now for it to be on repeat.
Well... Question is, do you want to be on morphine?
Well, no, I don't, but it does help with the pain.
Funnily enough, as a doctor and a GP, I don't want to give out medications to people. I only really want to use them when I absolutely have to.
My body's getting used to the 20/10, that's the only thing. And I know it can go up 2 more times, but I've got this big row with the job centre at the moment as well. They're trying to get me to go back to work, and if I don't find something or tell them that I want something, they're going to sanction me, which means I lose my money.
Right.
Which is not fair on me, because I know that I'm never going to work again. Because when my hands are bad, they're bad. It's enough to make just try and make a cup of coffee, and then she sits there. But oh look, I burnt myself over the weekend. I said, we're not talking about you. We're talking about me.
Okay.
When I first had pneumonia years ago, back when I was about 40, I was working for Iceland, and I was in and out the van, and you put the big coat on, you get sick because you're carrying all these heavy bags. So I'm sweat. Got pneumonia then.
Well, some people who end up in those sort of situations get colds, etc. They don't get pneumonia. There must be something making you susceptible to pneumonia.
Well,
what do you suppose that is?
I haven't got a clue. You
really?
tell me.
You don't. No
I'm
idea.
tired. I've only had 4 hours sleep. I had a bad night last night.
A lot of the problems that my patients have can be dealt with other things like exercise, diet, giving up smoking, not drinking so much. Those are the things which actually I need to be influencing and giving advice on in order to really improve the health of my patients.
How many are you smoking?
I've given up.
Have you given up?
Yeah. This might smell of smoke.
I wasn't aware because last month I think we got you down as still smoking and...
No. I think I might have had the odd 1 or 2, but that's it. Because they kept saying to me in hospital, give up. I said, I've given up. What's wrong with you people?
Okay.
I've just done it pure willpower.
Good. We'll see what effect the tablets have had on you, but it needs to be 3 months down the line.
Right, okay.
All right, Amanda?
Thank you very much.
No problem. All the best.
Wreck the joint before I go out.
Bye-bye. Take care.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help? No, Orleen, I don't have anything else today now. It's booked for you at 3:10, but I can't make it any earlier.
Hello, Mr. Gulai. Good to see you again. Please take a seat. Sorry I'm running half an hour late today.
Yeah, no, it's okay, don't worry. Yeah, so...
What's been happening with your symptoms?
Yeah.
Because you had quite a bit of pain, burning sensation after eating, acid in the back of your throat, worse when you lay flat, worse after alcohol. Is that all kind of, am I remembering correctly?
Yeah.
Great. And that all sounds to me very much like acid.
Okay.
I think you had a few concerns that it might be to do with your heart, but I hope I put your mind at ease. There's one thing I wanted to do, was I wanted to get the stool sample.
Yeah.
Okay?
Yeah.
To make sure there wasn't a bacteria that was causing the symptoms you were getting. But what happened was you submitted a urine sample.
Yeah, urine sample, yeah.
But it was meant to be a poo sample.
Oh.
So the urine sample, that didn't help, and then you didn't pick up the prescription.
Yeah.
So we kind of haven't really moved on as I would have liked to, but it's not a problem.
All right. So I don't need to fast for this one, huh?
No. This is just a poo sample.
Yeah.
But
what is poo sample? What's that? It's poo.
So you need to poo. That's where all the problems started.
Okay.
You gave me a urine, a pee sample, but I needed a poo sample, okay, a stool sample. So yeah, feces. That's what we need, because that can tell me whether there's bacteria in the stomach. Sorry, I wasn't making that clear.
Okay.
All right,
No
so
problem,
that's the key. That's the key. I'll be upset if we get another urine sample.
No.
Blue for poo. Easy to remember.
Okay.
All right.
What's his date of birth, please? And is this rash just come up where?
I mean, I can do a letter for you that says about the fact you've got epilepsy and about your other conditions as well. And then you talked about your mood. Tell me more about your mood.
I've been feeling really depressed lately because of a lot of personal issues. Everything that pretty much could possibly go wrong in my life has. I've been feeling kind of like suicidal at points as well. And just sort of like come home and like cry every night pretty much, and not feeling sociable at all. Don't really like go out, and I just feel like really down.
And then what specifically happened? So you said that there've been some things happening, but what's happened?
My granddad died, and
I'm sorry to hear that.
my brother was stabbed. My mum and my stepdad are getting divorced, and plus my boyfriend also is in prison as well, so that's quite stressful. and just sort of, I feel like I'm under a constant battle with like my sort of conditions and stuff. And like I just feel so worried.
You talked about feeling suicidal. What is it you thought about doing?
Just like, because I just don't see the point of going on, because I just don't have no one there for me at all, just to comfort me even. Not even, because I'm not really much of a talker anyway, just to like have that bit of comfort, you know, just to have a hug and say everything's going to be all right kind of thing. And so just like ending it really.
What is it you thought of doing to do that?
Just like slitting my wrists and just like chucking myself under a train. Okay.
How's your sleep?
Not good. I've never been a good sleeper anyway, but there's not really a lot I can do about it because of the medication that I take for my epilepsy.
When you talked about feeling suicidal, would you ever act on these thoughts? Would you ever act on those thoughts?
No, because I'm not a selfish person, and I know that I'd cause a lot of hurt to a lot of people if I'd done that.
Because it's important, if you are feeling suicidal, that you need to let us know or someone else know, because we don't want to see any harm coming to you.
Yeah.
Yeah.
No, I wouldn't do that because I'm not a selfish person like that. I wouldn't do that to them.
Have you suffered with depression in the past?
Yeah, but like not on, like, you know, bad things have like gone on, but you know, it's just not onto the degree that I feel at the moment.
We can refer you for counselling here if you want.
I've never been a great fan of counselling because I'm quite a private person. Like I said, I'm not really much of a talker. I can take everyone else's problems on board. Like, I'm a great listener, and I could just sit there for hours for someone talking to me and listening. But I don't really like the idea of just talking to some random person.
And have you thought about anything like antidepressants or medications? Is that something that you've thought about?
Yeah.
So one of the theories behind when people get low in their mood or depressed is that one of the chemicals in the brain is low. So antidepressants help to boost up that chemical. Quite often, you have to take them for at least a month before you might see any benefits of taking the antidepressant. You can get side effects. Common side effects with antidepressants tend to be nausea, vomiting, stomach upset. Some of them can cause problems with vision as well. Okay. Antidepressants, I wouldn't say that they're a long-term solution. I think they can be good to help get people out of a rut as such, you know, in combination with other things as well, because you've got to look at different life aspects, and if there's something that's making someone feel depressed, to deal with that as well.
I guess it's something I can try.
Yeah, are you wanting to try one?
Yeah.
Yeah. Quite a big proportion of our patients that will come in with, you know, either depression or feeling low in their mood or anxious or in a distressed state as well. On a daily basis, I might see maybe 5 or 6 patients that are going through some sort of form of distress. Because of the other medications you're on, I just have to double check about what we can give you.
Okay.
I'll get back to you at lunchtime today.
Okay.
All right then.
Okay, thanks very much.
All right, good to see you again.
St John's Medical Centre, Sarah speaking. How can I help?
Hold on, I can't. I need some more details. Could you tell me what the symptoms are, please? She's coughing, so she's got a cough.
Just breathe normally. I'm listening to your heart. Okay, good. Chest is nice and clear, your heart sounds normal. The first thing to say is you don't need antibiotics.
Okay.
What you have is a cold, so it's a... It could be flu, but even if it's flu is caused by a virus, and antibiotics don't work.
You haven't got no antibiotic I can take for sore throat?
Nothing, it wouldn't work.
Really?
Yeah, sore throat's going to get better on its own in 2-3 days.
Serious? No antibiotic? That's what I've come here for.
I'm afraid I've got bad news for you. Cough can last 10 days to a fortnight at least. Giving antibiotics doesn't help the cause. No antibiotics for the moment. Self-help, steam, lozenges.
Okay.
But I haven't got any magic wand.
Just say, wow, that is pretty clear cut. So that tonsillitis is so bad, you definitely need antibiotics. I mean, that's a clear cut case. So if any one of your friends asks you, doctors don't like to get antibiotics, that's the kind of classic case where you need antibiotics. It's pus, it's very swollen, your glands are clearly up. If those tonsils get any bigger, like if you actually find that you get a kind of ooh, that kind of noise, any hint of a noise like that, you have to take yourself down to A&E.
Does the effect of smoking affect it?
Smoking's not going to help it one bit. Had any thoughts about quitting smoking at all?
Yeah, I tried it for a week.
You tried it for a week? How many would you smoke a day?
20 a day.
20 a day. Before you're 30,
yeah.
If you just stop now, that's £26,863.
Yeah.
How much pleasure does smoking really give you?
Tons of stress.
Not as much as a £26,000 holiday, all expensive paid.
Yeah, but that's like in 10 years. Though.
Well, but it's still real.
Great. Got a gap. Woohoo. Somebody not turned up. Marvellous. Perhaps I can grab a coffee.
I'm going to go and eat some cake now. Bit of gat-ox.
I can help you today, Dwayne.
My mum passed away last year, February. I hadn't really grieved. I ain't seen counselling or breathing classes. I just haven't got time, to be honest, and that's me being honest. And I've got to be strong for my kids. I come up with some little rash just before Christmas, and I'm trying to keep my stress levels down, but my armpits are sore where it's flaring up there now. Crease in my arms, it's sore. My neck is sore, my face is sore, and that is stressing me out because my eyelids are getting itchy and sore. But my face has taken a piss. That I'm going to get stressed because it's really tender now.
Yeah. Okay. Do you want to pop your jacket off and let's start by having a look at your arms?
I've never suffered allergies. I don't know what's caused it. I don't think I've dealt with stress since I was 8. My mum's had asthma, diabetes, high blood pressure, blood clots, arthritis, and rheumatism. I've dealt with stress. I've never had nothing like this. It's all really sore, especially this part of my belly.
Yeah.
It's like it's inflamed, and I don't know what it is. My friends keep telling me it's not psoriasis, but I don't know. I've never had skin allergies.
Yeah, so there's different types of psoriasis that you can get, and where you get the big flaky bits, that's called chronic plaque psoriasis. This looks like a slightly different version of psoriasis.
Is this common?
No. I mean, by far the more common version is the chronic plaque psoriasis. This is different, yeah, and
will this go away, or am I stuck like this for life?
No. We will get rid of this for you. Don't worry. It's gonna be better than it is. This is not satisfactory for me or you.
Ella, this was the girl you called back.
Who is she?
The same one that you just spoke to.
What she want now?
The same thing she's arguing about.
Same question, Ella. Same question. The answer doesn't change.
Yeah, as you call back.
Yeah.
Which day did I last come to the surgery?
That might have been the dad, you know, that phone, because the dad sounds like a woman.
No, the daughter.
The dad's got
She's
a good
very
woman.
rude. It's a rude family.
Because one time, out of courtesy, I phoned them about Dr. Parker's appointments, and he went on and on and on and on and on and
St. John's Medical Centre, honey. How?
I phoned man twice, Colin.
I mean, psoriasis, if we're treating it correctly, it improves, but it doesn't improve like in a week. It takes like 4 or 5 weeks of sustained treatment, which is
That's what I heard. It
It
would take 5 weeks. That's what the hospital told me. 5 to 6 weeks.
The one thing that I would add in, which you haven't had yet, is a steroid. And I think that would really help with the soreness and the redness.
Okay.
As, hopefully, the sun comes out a bit more, and we will encourage you to get out in the sunlight a bit more as well, because sunlight helps to improve this as well.
What about sunbed? I've never used it before, but I jump on out of that to get rid of it. Well, I'm serious. I don't need to use it, but I jump on it if it gets rid of this.
Yeah, it probably would.
Probably would?
It would probably help, yeah. That's not to say go mad on sunbeds.
No, I wouldn't go mad. I don't need to go mad. I've got an all-year-round tan. It never peels, never fades. But this is annoying me because I don't suffer from no allergies.
We will see what happens over the next couple of weeks. Like I said, if you feel it's getting worse, just come back and we'll get you seen by the skin specialists.
Okay, then.
Great, and yeah, I mean, ultimately come back to, you know, the stress that triggered it all off. I mean, is your mum, the loss of your mum, is that something that you think you would like help with at some point? Or?
To be honest, I do security. I do between 60, maybe 80 hours a week. I physically ain't got time.
You ain't got time.
Yeah.
Life's in the way.
But I'm all right. I know my mum would want me to be strong.
Really fill your boots. Go. Going, keep going, keep going, keep going, keep going. Keep going, keep going, keep going. Keep going, keep going, keep going, keep going. Keep going, keep going. Stop.
Hello, sir.
How are you?
I'm good. How are you?
I'm all right.
Last time we met, you were due to go back and speak to the surgeons about the operation for your colitis. Any further thoughts about whether you would consider the surgery?
You know, I don't want to have a surgery. I don't want... You know, they want to take all of my bowel out.
I know.
Which is wrong, you know. I don't want to be, you know, abnormal person. This is better if I go with my sickness and die one time. That's good, yeah. But I don't want to look, you know, someone who is abnormal, to have a bags every time. I don't want it, I don't want it. You know, I hope that I will get better or die, you know.
Think about it this way.
I will.
You know, if you have an operation, you don't have to worry about being up 5-6 times a night, always needing to be near a toilet, constant blood, and the diarrhea. All of these experts, they're pointing towards the same thing. Yes, you'll have a bag, but in day-to-day life, you know, that's something that you'll become accustomed to.
I know only what you think, but still I believe that I will get something before that.
What do you mean?
You know, or some technology will come, or it comes by itself. So maybe it will go by itself.
That's a very optimistic point of view. However, we haven't seen any miracles yet. There are no cures. This has been the standard management for many years.
I will think about it. Let me think about it. Let me see. Yes, it has not any other option. Then, of course, I will go. But let me, yeah. Let me think a little.
Would it be possible to see a doctor today? It's a bit serious. I found some blood in the urine.
Okay.
It's a bit worrying, you know.
How are you feeling today?
When I'm lying and I keep tossing and turning in the bed because of the pain, the bandage just go down, you know what I mean? And sometimes when it goes down, it gets tight down the bottom.
Is it painful still down here?
To be honest with you, it's painful from the stump of the big to go around. God.
I've injured my foot. I went quite a long walk on Saturday, and I think the boots are rubbing on this big toe. It was a massive blister.
Let's have a look at it. What I think we'll do, because it's a hot, sweaty area, you've got an open wound, there's a huge potential for germs to get in.
Right.
And what concerns me is if there is a bit of redness, is this the first signs of an infection?
So what I'm going to do, Mr. Phillips, this bit over here, just going to put a bit of Inadine on that, OK?
Twice a day,
Yeah.
you put that foot in hot, soapy water, not too hot, so you wash it really thoroughly.
Yes.
Then you dab it dry, or use a hairdryer to dry it.
Yes, yeah.
So that it's completely dry.
Yeah.
And then you put the antibiotic cream that I'm
Yes.
going to give you, and then you can cover it with a suitable, appropriate plaster.
Okay.
You OK?
Yeah, come.
This is just on lightly, OK? There you go. You feeling OK?
I never feel okay, really, would I?
Doesn't hurt there?
No.
Doesn't hurt?
Could you do me a wee?
Now?
Yes.
Right.
No time like the present.
My name is Dee. And
Good morning, Dee.
And you too. Now, this is just a health check, very basic health check, OK?
OK.
If you have any medical problems, then it would be a GP that you make an appointment with, OK?
Yeah.
So where have you moved from?
From Greece.
Straight to London?
Straight to London.
Oh, how long have you been here?
About 4 months.
What do you think?
I love it.
Do you?
Yeah, I love English people in London.
What made you decide to come and live?
Here, it's so big, your country is so big and there are many opportunities.
Yeah,
and
true.
the thing is that you are organized.
Do you think so?
Yeah, I like organized countries.
All done. Finished.
I've had an awful lot of trouble with this printer here. Just don't seem to be able to get it to work.
So what's wrong with this? Oh my God. Oh.
You don't know how to use none of the equipment them in here.
Yeah, no, you
and
have to
all you girls.
Sure.
You trying to hide? Huh? You trying to hide from me?
Come and have a seat. Hello. How are you these days?
Oh, well, most things are fine.
Yes.
Same old, same old. My sleep
Oh.
is terrible, and I've not had a good night's sleep for a couple of years.
You've got to a sort of certain age now.
Oh, God, yeah.
Do you think the menopause has got anything to do with this?
Oh, yes, I do.
Are you
But
getting
I think
hot
I
flushes?
did. I was.
Sometimes it helps, to cope with the lack of sleep, to have what we call some talking therapy.
Yeah.
We've got some superb counsellors, if only just to sort of help focus on how you feel and how you can cope when you haven't got any energy and
Yes, all the
you can't
time.
get through work.
All the time.
If up here is not at peace with the world,
Yeah.
how can you expect to get a good night's sleep?
Yeah.
OK, well, have a think about it.
Right.
But let me put this to you. We're not superhuman, and just sometimes we need something to kickstart us into feeling better.
Yes. Yes.
I've known you long enough to know that actually you have been coming to me with this problem.
Yes.
And perhaps now's the time to try different tacks.
Yes.
How does it affect you? Like, are you aware of it? Are you conscious about it, or does it not bother you?
Doesn't bother me.
Doesn't bother you. Okay, good. I don't know. Did my colleague tell you it's called pityriasis alba?
Yes.
Yeah. With this type of pityriasis alba, unfortunately, there's nothing that we really know kind of makes it better or worse.
Maybe antibiotic, maybe.
It's not anything to do with a bacteria or an infection or anything like that. It's getting better, and hopefully at some point it will be gone. What I will do, I'll give you a tiny little bit of hydrocortisone, 1%.
Okay.
And you can put it just on these patches around there, not around the eye because the eye is very thin, but just for 3 days, just once a day, just for 3 days, and then don't use it again, and just see if that makes any difference. Some people say it does. Any other questions? Is there anything that's worrying you at all?
Anything question? Just put it. Soak.
No. Are you interested in anything to do with those leaflets? Your mum will be even more worried.
I need them.
Do you?
I want to read it.
Are you just reading out those for interest, or is there something you want to talk to me about?
No.
You sure?
Mm-hmm.
All right, okay. Well, the door's always open if you ever want to come back and talk to me about anything from my broad selection of information.
But he's still young
leaflets.
for know about that.
Yeah, I think so. I think so.
You'd be surprised how frequently patients will come in and they won't actually tell their doctor why they're there. And it's really important that we know about that. And we do have a term for it. It's called the hidden agenda. Essentially, your main tool for everything is listening, and there will always be cues.
So you basically just tick that box and hand it in. They'll put tell us off and just hand it in. Okay, when you need another one.
Also, the body language. If someone looks uneasy or they're avoiding eye contact, you just pick up on things.
Nice meeting you.
Thank you.
Take care.
Bye.
Do you want to talk to me about it?
No, I just need it.
Can you just give me 1 second? I'm going to ask your mum. Do you mind if I have a chat with you alone for 1 second? Without your mum, would that be all right? Do you mind if I just have a quick chat with Semi-Solo alone, just for 5 minutes?
Okay.
Yeah?
It's really important that young people and children feel able to speak openly to their GP, and sometimes that'll be about things that they certainly wouldn't want to speak openly about with their parents, for example. And I think it is important sometimes, even if someone is, say, under the age of 16, to have a moment of privacy.
So, the ones you were looking at were these two. What was it that made you think that you might need some of these?
I don't need them. I just need to get something. I can't reach it.
What do you mean get something?
I dropped something.
Whereabouts?
In the heater.
And you want one of these?
I need to get it. I've dropped my 50 pin. I need to get it.
Okay, so you don't need anything. You don't know what these are all about, and you don't think you need what these are.
Just grab them.
All right. Okay.
But obviously, yes, sometimes our intuition isn't spot on.
Well, you know what? I'd rather you didn't use my information leaflets to get your 50p. Maybe try a ruler. Do you have a ruler at school?
Yes.
Maybe use your school ruler or something like that.
No, just
Would that work?
yes.
All right. By all means, have that. Okay? Take care.
Bye.
Cheers. Nothing to worry about, okay? Take care.
Okay, thank you.
Oh dear. Friday.
Has she offered any explanation as to why she's, 25 minutes late? 25 minutes late. I mean, I'll see her. It's fine. Okay, bye.